Throughout these series of videos, we talk about the importance of diet and exercise for the prevention of everything from heart disease and stroke to Alzheimer's disease and even diabetes. One of the foremost advocates of diet and exercise is Dr. Dean Ornish, a professor at the University of California at San Francisco and president of the Preventive Medicine Research Institute. He has used high-tech diagnostic tools to show that rigorous diet and exercise can be as or more effective than medical or even surgical treatment.
People often have a hard time believing that these simple choices that we make in our lives each day, like what we eat, how we respond to stress, whether or not we smoke, how much we exercise, the quality of our relationships, that these simple choices can make such a powerful difference in our health and our well-being, but they do.
As they did for Mel Leffer, a 73-year-old from California.
I ate out every night, I smoked cigars, I drank, I was a couch potato. I just had a sedentary lifestyle, totally sedentary.
But then Mel suffered a heart attack.
I had terrific chest pain. It just wouldn't go away, and I just was in total denial.
His physician didn't think he could undertake the rigorous new lifestyle required by a study of lifestyle therapy that Dr. Ornish was conducting.
Actually, my doctor told Dean not to take me into the study because the study was only for 1 year, and he told Dean he didn't think I would last the year.
But he embraced diet and exercise.
Immediately, the tightness wouldn't come as fast. I was able to walk. In a month, I started to feel really good.
In terms of preventing or reversing heart disease and other illnesses, just walking 20 or 30 minutes a day or an hour 3 times a week gives you most of the health benefits while minimizing the risks.
The key lesson? When moderate changes don't work, it doesn't mean that diet has failed.
If your cholesterol is high and you're just trying to lower it, start by making moderate changes. If that's enough to get it down, great. If not, and for most people it isn't, it doesn't mean that you failed diet, it just means that you probably need to make bigger changes in order to achieve those goals.
Many physicians go straight to medication if moderate changes don't work, but the other choice is more aggressive exercise and diet.
I eat a low-fat diet. I try not to eat more than 10 to 15 grams of fat a day.
When you make big changes, you feel so much better so quickly. It reframes the reason for making them from risk factor reduction, which is boring, or fear of dying, which is too scary, to joy of living. And joy of living is what makes these sustainable.
While diet and exercise are important, Dr. Ornish has shown that a third component is crucial: relaxation.
There's some simple techniques that you can practice on a regular basis. Even a few minutes a day can make a difference. Meditation, stretching, breathing, yoga, tai chi, prayer, secular, religious, whatever appeals to you the most. These techniques have powerful values in both managing stress and in transforming your life.
Ann Ornish teaches a class at the Preventive Medicine Research Institute.
In the simplest of forms, I would say just giving yourself 5 to 15 minutes a day just to be still and to scan inwardly into what are the patterns of your thoughts, of your feelings, and your behaviors, and come out of that with which ones are serving me, which ones aren't serving me.
With these 3 components of diet, exercise, and relaxation techniques, the results can be equal to or better than medication.
In our studies, we had a randomized controlled trial which was published in the Journal of the American Medical Association, and we found that there was a 40% average reduction in the LDL or bad cholesterol in a year in a free-living group of men and women, none of whom was taking cholesterol-lowering drugs.
The gold standard test, the angiogram, showed remarkable changes inside the arteries.
Their arteries became measurably less blocked after a year, and there was even more improvement after 5 years than after 1 year.
Aggressive lifestyle changes work with other diseases. A landmark study, the Diabetes Prevention Trial, shows that prevention works in people with pre-diabetes.
If you lose about 7% of your body weight and you walk regularly 30 minutes a day for 6 days a week, you reduce the risk for developing diabetes by 58%.
Dr. Ornish's latest research focuses on men with prostate cancer. Helping to lead the study is Dr. Peter Carroll, Chief of Urology at the University of California at San Francisco.
We do see that lifestyle intervention has these favorable effects on this cardiovascular risk. And we are beginning to see that when we measure gene expression in the prostate, we are seeing changes occurring in the gene expression. So we're testing the hypothesis that a lifestyle change does something beneficial to the prostate itself, not simply lower your PSA a bit.
Jack McClure has prostate cancer.
My PSA went up. It was over 10. And that was 5 years ago. It actually went up to 11.
A PSA or prostate-specific antigen over 2.5 is considered abnormal. Rather than radiation or surgery, Jack chose a program of active surveillance, appropriate for men with a low-grade, well-contained tumor.
At UCSF, what we do is we start with an extended pattern biopsy. We do PSA measurements every 3 months, at least for the first year, ultrasounds at 6-month intervals, and a repeat biopsy a year.
Jack also undertook Dr. Ornish's lifestyle program with diet, exercise, and relaxation. After a year, doctors looked for the cancer again.
They did a biopsy, they confirmed that I have prostate cancer in 2003. The last 2 times I've had a biopsy, they can't find it.
A big part of the program is mutual support. This group meets regularly at the center. It helps with whatever inner doubts they may have. The risk is that the cancer begins to grow.
So between 20 and 35% of men progress on active surveillance, and when they progress, we're able to intervene with treatment, which appears to be just as good as we treat them right away.
Still, these men have major benefits.
Remember, the #1 cause of death in men with prostate cancer is not prostate cancer, it's cardiovascular disease. So lifestyle modification clearly improves cardiovascular health.
Not everyone is dedicated enough to pursue such a vigorous program. For them, a moderate diet and lifestyle program with the addition of medical therapy can still yield tremendous benefits. However, for those willing to make the commitment, you may find you've never felt better.